Rockford Eye Care. And Dr. King, good to talk to you. How are you?
Hi, Dean. I'm great. How are you doing?
I am good. And you know what? I wanted to let everybody know that with school coming up, that you got to get your children in for that eye exam, and we've got some special things coming up over at Advanced Rockford Eye Care at 695 North Perryville Road, and you got a lot of exciting things. Can you tell us about it, Dr. King?
Well, we're really trying to promote our back-to-school exams for children of all grade levels. It is mandated for children entering kindergarten, but it's essential for children entering every grade. But we're really trying to promote that. Back to school's right around the corner, and it's good to get going on that ahead of time. We're already starting to see our back-to-school exams coming in. We have been for a while. But certainly something parents want to start thinking of already.
Absolutely. And, one thing I don't think I've ever asked you this, Dr. King, as far as any insurance for eye care, does your office check with the insurance companies and see what's available as far as, your patients' insurance?
We do. As a courtesy to all of our patients, we call and verify all insurance benefits. A lot of times patients don't realize that medical insurance covers vision exams as well as vision insurance. So we call and get all those benefits ahead of time so there's no surprises, so they don't show up and find out that there's no insurance coverage. We get that all ahead of time.
Okay. And again, for everybody that's just tuning in, we're talking with Dr. Jaime King. She's with Advanced Rockford Eye Care. And if you have a question, and we did have somebody call with a question and didn't want to go on the air, they're wondering about sunglasses. If the tint, you see some with brown, some with blue, does that matter? Is one better than the other?
Color-wise, that's not necessarily. It's what's within the lens as far as UVA, UVB protection. Usually a darker lens does help, but if it doesn't have that UVA or UVB protection along with it, sometimes it can cause more problems that actually help protect the eye. We have equipment here, actually some of our new technology that helps us evaluate the percentage of UVA, UVB protection in a lens. And we've obtained this piece of technology because we've had so many of our patients who've brought in their glasses that they've been wearing, that they've gotten who knows where, and we're finding out that a lot of these lenses may not have the 100% UVA that the sticker that was on the lens said it had. So that's been pretty cool to be able to show patients that that's not really what's in the lens.
Now, the other thing I was going to ask you too, if folks have not had an eye exam for, over a year, there is a lot of diseases that you can pick up during this eye exam. Is that correct?
Right. So not just routine exams. We don't do just glasses and contacts. We also, through every exam, no matter what the age of the patient, look for things such as glaucoma, macular degeneration, breaks, tears, tumors, all sorts of things that can be going on in the eye without any signs or symptoms to the patient.
Yeah, so it's important that you get in there and, just take this. And how long does an eye exam take?
I tend to dilate most of the patients, and that's another thing that everybody should be looking for in an eye exam. If you haven't had your eye dilated, it might be something you would want to ask about. That's the most important part of the exam. That's how I evaluate the health of the eye. But when we do that, it takes a little bit longer, usually about 45 minutes.
And Dr. King, if people are having a pain in their eye, and it's been more than a day, or at what point should they start getting worried, saying, I really do need to get in and find out what's going on?
Anytime there's something that changes suddenly, whether it's pain or a sudden change in your vision, that's something that should really be addressed sooner than later. Any quick changes, probably that's the quicker you need to get help or have it evaluated.
Okay. And now you have an event coming tomorrow. Are you have extended hours tomorrow, or what is the hours, Dr. King?
Tomorrow we're actually open. We're extending our hours a little bit. We'll be open until 7 o'clock.
Okay. And people can go and just check it out. You're going to love, Advanced Rockford Eye Care. Go in there, and they've got some great styles, not only for adults, but also for children's. And here's the one thing I want to make sure everybody is aware of. They're all different price points. So if you're thinking, well, maybe I can't afford, some of the frames that we talk about, some of the stylish frames, well, you know what, there's all different types, and we encourage everyone, please get over there till 7 o'clock tomorrow night. Also, make sure that your children can get in for their eye exam. Dr. King, as always, it's great talking to you.
Well, thanks for having me, Dean.
All right, and we'll do it again next week.
All right.
All right. Thank you, Dr. King.
Thank you.
All right. She is Dr. Jaime King. We are going to take a quick break. We'll be back with more. You're listening to 1330 WNTA. We're all local all day.